following video is not affiliated with any support groups, religions, treatment centers, or institutions. This is an editorial and is not medical advice. Enjoy. Today's question comes from Robin R., and it is this. How about marijuana maintenance and CBD? We've been hearing a lot about this lately in support groups. And I've been hearing this in Canada and in the United States. Just for the record, I am not on this program. Thank you, Robin. It's a very good question, and it is a very relevant question. So, you know how the drill is around here. I'm going to start the timer. So I've got 1 minute to talk about quote unquote marijuana maintenance or cannabis use in recovery. 3, 2, 1, start the timer now. First of all, personally, myself, I do not use cannabis and I don't use cannabis products. And what I can say is you have to consult a doctor, you have to consult a psychiatrist, and you have to consult a counselor for you to get any information for yourself. So it has to be tailored to yourself. I'm not going to make a judgment either way if cannabis use is proper for you, or if it determines if you are quote unquote sober or not. But some interesting facts. It does affect mood disorders, and it does affect issues like depression. Not necessarily CBD, but the jury's still out on that. But what I would say is that cannabis in its just straight up form can affect your mental health. I will definitely go up to bat, and I believe in that. I almost got my point out.
Didn't like my answer? Maybe I didn't either. Stay tuned to the end for my final assessment.
Okay, now it's time for me to grade and evaluate what I just said. And obviously, I'm emotional about this because it has a lot to do with my own story. So I'm going to get to my story at the end of all of this. But before I do that, I just want to state a few things that are in the realm of facts. I'm not the expert on this, but I know and I can state this with confidence that cannabis in its unfettered form, the natural form that you would pick it and dry, if you have a pre-existing mental health condition or a mood disorder, depression, schizophrenia, schizoaffective disorder, a personality disorder, it could be anything in the realm of a serious mental health disorder, generalized anxiety, OCD, anything like that. If you have a major psychiatric diagnosis or have the potential to get that, if it's genetic in your family, marijuana could possibly affect your mental health. Cannabis on its own, it can cause drug-induced psychosis if you have a pre-existing mental health diagnosis. And if you aren't sure about this, there are psych wards that are full of individuals that are in drug-induced psychosis that have only had cannabis. It's proven hard science. It has been proven through years of observation and treatment. And how do I know this? Well, my first psychiatrist was Dr. Bill McEwen, and I was 17 when Dr. Bill McEwen was my psychiatrist, and there was mental health in my family, mental health issues in my family genetically. So this was when he was stationed in White Rock, British Columbia. And soon after that, he founded the Early Psychosis Intervention Program, which is something that you can look up, and I will link, and it will be down in the comments as well. That looked specifically at younger minds as they were affected by numerous types of drugs. And when I was in that program, I did see a lot of peers like myself struggling with cannabis specifically. And also he moved on to the UBC School of Psychiatry. He also did work with students at St. Paul's Hospital in Vancouver, British Columbia. And that was another psych ward that was full of individuals that were on different drugs, but many people strictly cannabis. And I was in there at one point that I had a drug-induced psychosis that was due to cannabis. And at that time, he prescribed me a course of medication. This was 11 years ago, that treated my mental health diagnosis. And I was given strict instructions not to use cannabis. If I wanted to stay clean and sober, and I wanted to continue to maintain my mental health, I needed to stay away from cannabis and all mind or mood altering substances, alcohol, and every drug, and stay on this medication that was meant for epilepsy, but actually treats a mood disorder, bipolar disorder. So Bill McEwen, I will link that doctor in my description. And if you Google that name, Dr. Bill McEwen, you'll see that he has a lot of history of working with people with mental health issues and dual diagnosis, and his opinions on cannabis pretty much informed my treatment and my continued sobriety. So I owe a lot to his influence in the mental health community and the addiction community. So he's one person to look up, and there'll be some links for him. He does a lot of work with harm reduction right now in the downtown Lower East Side of Vancouver, but he's moved around to many different reputable institutions, and he maintains the tie to cannabis and drug-induced psychosis. Another psychiatrist that would echo this is Dr. Mel Vincent. He is an author and an educator. Again, I will link to a video of him talking, maybe not specifically about that, but do your research, look him up, look his book up. And Dr. Charles Welton, who's a colleague of Dr. Mel Vincent, two psychiatrists that would echo exactly what I'm saying about cannabis. Also, Health Canada, a committee of doctors across the entire country that I live in, where cannabis is legal, have also looked at this issue, the issue of the growing mind and also the susceptible mind. Those who are susceptible to mental health diagnosis, and those who are also before the age of 25. Your mind's still growing, and so it is a risk to take cannabis at a younger age. This is also echoed in a wonderful documentary piece by Canadian documentarian and journalist David Suzuki on the nature of things, on marijuana and the psychotic symptoms that can go along with it, with the younger mind and with those specifically susceptible to schizophrenia. So that's in there as well as some bona fide proof. And that's why I can stand firm and say, yeah, I'll get up to bat and defend this. Definitely. It's something that I strongly believe. And I do this because my story with marijuana is, once I started, I couldn't stop. I had no way of controlling how much I used. There was zero moderation at all. And it had a disastrous effect on my mental health. Marijuana works on my mind like crack would work on your mind. Plain and simple. Some people chill out when they're on marijuana. When I take marijuana, my mind is wired differently, and I get an energy boost. And you cannot shut me up, and I want to be the center of the party. No joke. And it'll land me a trip to the hospital, and I'll be there for weeks. That is the honest to God truth. It happened 4 times in my life. So I myself was in the early psychosis intervention program when I was a teen. It didn't stick. I relapsed many times. But again, look that program up. It was started in the early 2000s. And I can say this because I'm really confident in what I've seen in treatment centers that I've worked at, in support groups. Time and time again, people who have susceptible minds, or even people who are just addicts, they use marijuana. And they use it to a detriment, really. Now, there's people whose minds aren't wired to addiction. And you can see them use marijuana. You know, there are people related to me that don't have addiction issues where they could have a puff like they could have a sip of some wine. That they could have maybe a half pint of beer, maybe once or twice a week, and have a casual joint at a concert. But for me, I would be at the bar drinking those beers until it closed. And I would use all the cannabis that I had bought and go back and buy more. That was just my story with cannabis. Now, I have to say this though. We're in an early age of progress with cannabis where it is being legalized, and the potential of the therapeutic value of it, where you would take out the THC and be left with the CBD and look at the other therapeutic properties. And from what I can tell, it is too early to really unlock the potential, but there's potential there, and I'm not going to deny that. There's potential for therapeutic uses of cannabis. Absolutely. And that's why, again, I go back to balance. Doctor, counselor, psychiatrist, public health nurse. Ask them for appropriate research. You need to be guided by people that have appropriate knowledge. You don't want to just find someone's opinion on the internet, or, find someone who is a naturopath or a quack on the internet that's going to tell you, yes, use cannabis. Go to an MD if you're an addict. Go to an MD if you have a mental health diagnosis. Fight hard to see a psychiatrist. Get in to see a psychiatrist. Go to your local public health unit. Wherever you are, reach out for help. Find the public supports. Fight to find them. Fight hard to advocate to get that knowledge, because your quality of life really hangs in the balance when it comes to self-diagnosing with cannabis. So that's all I have to say. I'm going to say that I did an all right job answering the question. I think I could have done a little bit better. I'm around 60%. So what I'm going to give myself is I'm going to give myself one spare tire that is very bald. So a bald spare tire, and it's a spare tire. It's not a full-size tire. So if you've ever driven on one of those, I know that I have. It's a little bit disappointing. And I'm also going to give myself a bag of sand. Well, you have lots of uses for a bag of sand. It can, be spread around to make sure that it's, there's more grip and you don't have ice on your front steps when it's snowy out. You could use it to build a sandcastle, but you need to apply it to something. So I had a good rudimentary answer, but there definitely could have been some better articulation, I would say, in the answer. So that's all I have to say for today about cannabis. If you have questions, if you have comments, if you disagree with me, I welcome the discussion in the comments, because I'm sure that some of you must have a few things to say about cannabis use. And it definitely is a topic worth talking about. So again, thank you so much for tuning into the video. I really appreciate it. Always willing for you guys to comment, to share, to engage, and I welcome that. It's so much fun making these videos, and guess what? I'll see you in the next video. I look forward to it. Have a wonderful time. Until next time. There's plenty more videos for you to watch linked right here.